In this video, I'm going to talk about phobias. Now, phobia actually is a psychiatric term and a psychiatric diagnosis. But basically, in simple English, what it means is that somebody is afraid and is fearful. Now, the fear actually is normal, you might say. Yes, it is normal. Proportionate fear is normal. Now, if you, for instance, see a snake and you're afraid to approach it, that's normal fear. However, you see a dead, let's say a spider, and you run, you will never come to the room where the dead spider is. That is irrational fear. If you see a cockroach, for instance, that is irrational fear. So there are different types of phobias. You might have heard of agoraphobia. Then there is social phobia. Then this particular instance, what I told you, what I was talking about, the fear of spiders, is called arachnophobia. So there are different types of phobias. Now let's take, for instance, social phobia. Social phobia is a condition where you are fearful or you are afraid of being scrutinized by people in the society. Now, this has to be distinguished from social anxiety. Now, let's say a little bit of anxiety actually might be helpful. Say, for instance, if you are going to give a speech, you get on the stage and sing. A little bit of anxiety can even be helpful. Now, when you say phobia, that is different, because in phobia, you avoid the whole thing. You like to avoid, and the fear is so intense. What happens when you avoid? Actually, the process of incubation is called incubation, takes place, where the fear is enhanced due to this avoidance. So we talked about arachnophobia, the fear of spiders. We talked about agoraphobia, fear of spaces. Now, what is the treatment? The treatment is not only medication but also therapy, especially cognitive behavioral therapy. And one form of cognitive behavioral therapy is exposure, not avoidance. So exposure can be done gradually, what is called systematic desensitization, or it can also done suddenly, it's called flooding. Whatever that the method of exposure might be, is exposure, and it is a part of the CBT. There are various other forms of treatments as well, and as I said, the medication can be used. So phobia, or the fear, is a treatable condition, and it is your duty, for your sake as well as others, to get proper treatment.